Hello and welcome to ELNEC Geriatric. My name is Dr. Carol Long. I'm from Arizona State University and founder of Palliative Care Essentials in Phoenix, Arizona. And I'd like to welcome my colleagues.
Yes, I'm Dr. Barbara Head, and I'm an associate professor at the University of Louisville School of Medicine and the Kent School of Social Work.
Hello, I am Dr. Pat Berry. I'm professor and director of the Hartford Center of Gerontological Nursing Excellence at Oregon Health and Science University in Portland.
We've been very excited to bring forth the new revised ELNEC Geriatric curriculum this past year. And the reason we're excited is because it's community-based in the care of older adults.
Right, and it really addresses the differences in care for the older palliative care patient and their special needs and considerations.
And I also think that, Carol, when you revised it, you actually added a section on geriatric syndromes, things that are unique to care of older adults. And I think that really brings the symptom management module alive.
And what we found over the years is that the attention to the needs, special needs of older adults is really profound. Understanding normal physiologic changes that occur with aging, but what happens to the older adult when they start having problems related to their various medical conditions.
Yeah.
Right. And there's so many older adults. It's just phenomenal, the growth in that population.
And I think that that it's important to understand older adults, what's normal, and also the symptoms that happen at end of life, and how we as nurses can help normalize those things for persons and their families.
So one of the things we focused on this first time around with this revision has been the additional information for nurses to take back, for families and patients to become more empowered and understanding their care needs with their terminal conditions.
One of the modules I teach is grief and loss, and I especially like that it considers the special needs of the older patient in terms of the many losses they experience toward the end of life, and how we can help them cope with those losses and the loss of their own life, which is something they're definitely grieving at that point, and also how we can work with their families and also the staff to meet their bereavement needs and be sure that they get the care and support they need during that difficult time.
Of course.
Another significant module is pain assessment and management, because we know that pain adversely affects the quality of life of older adults along their journey as well as at end of life. So our attention to people who are cognitively impaired as well as those who can self-report is significant in this work. We also get into a lot of detail about the significant interventions we can do to help control pain.
And one of the modules I teach is Final Days, and in my opinion, that module is one of the most important things that we teach, because unlike other things that we do, you only have one chance to get this right. And this module looks at supporting families, supporting the person who's dying, the staff, and also talks about care right before and after the time of death. There's lots of myths about that, and all of this, of course, is contextualized by culture and what people want and what makes people most comfortable. ELNEC is helpful to almost everybody who cares for older adults and their families. Because of the focus less on nursing home and more on community care, it is actually relevant to nurses, licensed staff, in some cases certified nursing assistants, chaplains, social workers, administrators of organizations, and we have had faculty come and have gained a lot from also attending this because of the special needs and the special considerations for people who are older at the end of life.
So we would enjoy the opportunity to invite you on our journey as we care for older adults, and the need will continue.
Any professional that works in palliative care, unless they're specialized to peds, deals with a lot of elderly patients. And I think this curriculum is appropriate for the generalist palliative care practitioner, and the specialist palliative care practitioner, as well as hospice nurses, because so many of their patients are the elderly.
We must address the unique needs of older adults, and particularly with our aging population. It's really an imperative that nurses and the entire care team learn more about geriatric palliative care. So in saying that, we hope to see you soon.
Thank you.